Let's give this patient perfect immediate lips so she can walk out and can show everybody her lips right away. So let's go ahead and start. She's well cleaned off. She had some Comfortox BLT as an anesthetic, topical anesthetic for about 5-10 minutes. Now what we are going to do is we are going to start in the Cupid's bow right at the apex and bring it up using a right angle technique. But that's all we need the right angle technique for this way. And we are going to be those a superficial injection, as you can go ahead and see, a little bit pinchy, that's for sure, going down to the wet dry line, but staying superficial just to bring up that apex of the Cupid's bow. So that's all we wanted to do right at the base of the philtrum right there. The rest we are going to go ahead and just volumize these lips, upper lip and lower lip, as you are going to go ahead and see here. So that is what we're doing. That we used a Comfortox syringe backfilled with filler here, and now we're going to go to volumization. And the point of the right angle was just to give more height and little crisper apex of the Cupid's bow. But now we're going to go straight from the filler syringe, and we are going to go ahead and volumize, but in a very particular way here. We are closer to the vermilion border because we want to go ahead and kind of flip out that vermilion border and get a little bit more show, but also some more projection. And as you can see, we just fan to go ahead into the middle of the lip. And you can see right there that this lip is already looking more volumized, just like that. So this is really a combination technique of what we're trying to go ahead and achieve. But as you can see, this patient is going to have lips that she'll be able to walk right out with. Now compare that side of the upper lip with the side that we're doing now, and you can see volumization, and it didn't take very much. It's about placing it in the right place. And here again, with this technique, we are starting near the vermilion border and then fanning into the body of the lip. So this way, it's just not an additional poke. And then the patient will subsequently get number because of the lidocaine that is in the filler syringe here. So now we're going to start from the oral commissure in the lip, and we are going to place another thread going into the upper left lip here. As you can see, more in the body of the lip, and as you can see, that is what we have done, and that is looking pretty good. Now immediately it is going to be a tiny bit swollen and start to get some water here, but you'll see what happens to this lip as we come back a little bit later for that and let it absorb some water. So now let's go to the lower lip. As you can see here, we're going a little bit off the vermilion border, more into the body of the lip, determining from our examination what we talked to the patient about and what she needs there. So as you can see, initially she's going to get a little bit of swelling, but that swelling is going to go away. What's our trick? You'll see that a little bit later here, but it is very careful technique. Now we are in the pout area, and that pout area is in the body of the lip, in the middle between the vermilion border and the wet dry line, as you can see. As we have gone ahead and given that, let it sit for just a few seconds. It's going to absorb some water, and we can then go ahead and evaluate it. You never want to overfill lips. The little bit of swelling and water you get, you can definitely go ahead and overfill some lips. We've gone back to the Comfortox syringe for a little bit more precision on this area, and it did not need as much. As we go from about a third of the lip back to the oral commissure, we don't need as much filler, and we wanted a little bit more precision there, as you can see. And we are always worried about the vasculature, always looking for the arteries. Sometimes those arteries can be superficial. We can actually see them. But now you've seen just a little bit of that volumization. It didn't take much for this patient, but now this is really crucial. Smoothing that filler in and settling everything down. And as you can see, that little bit of swelling that we had has started to go away a little bit, but we want to go ahead, use it all to our advantage as the filler starts to absorb some water and smoothing. You're only as good as your smoothing, and that is to make sure that the filler, there are no lumps or bumps or anything else here, and with just a few injections, we've got some really nice volumization here. Now, could we give more? Sure, we could give more right now, but we don't need more right now because, like we said, it's going to absorb some water here. But let's shape the filler, and that is the best way to really shape the philtrums there and really shape some of the cupid's bow. As you can see, this is going to look fantastic, and she's going to have minimal swelling, no downtime. She'll be able to go right out with these lips after we go ahead and do a little bit of aftercare there as well. Always pays to go ahead. Take your time with this. Let it absorb water. You're going to go back. Where do you need some more? We want to roll out the pout just a little bit, really precision. So we use the rest of the filler that was in the ComfortTox syringe here on both sides. And that's going to roll out that pout. Now, as you can see, this is very close to the vermilion border because that's how you roll out that pout. Volumization is going to be in the middle of the lip. As you get closer to the vermilion border, especially on the lower lip, the central third, that is going to roll out that pout, and that looks fantastic. Now, after this, and we reshape this a little bit with some smoothing there, what you don't see right now is we are going to go ahead and put on some ComfortTox Lips Aftercare. It's a serum and a balm, and here come the before and afters, the immediate before and afters, and that looks spectacular. And the ComfortTox Lips is fantastic at going ahead and reducing the swelling and no downtime right away and getting it under control with the ingredients in the ComfortTox Lips. It's fantastic. Gives a nice shine so a patient can go right out and show everybody their lips. That's what they want. Stop telling patients that they've got to hide out for days because they are getting a lip enhancement. You don't need that on most patients. If you go ahead and do a very controlled lip enhancement, pick the right patient. We can use pre-op medications, but especially aftercare is important with ComfortTox Lips, which you'll take home and continue for the next few days to keep it under control. You can learn to do this too, and your patients want perfect immediate lips. It's time for you to get AAFE certification trained today.